I want to ask a very, very serious question. And this is for clients or those of you all who may be thinking of engaging an agency. When you contact an agency for a caregiver, you start with the conversation. Okay, so I was given your number. I heard that you provide caregivers that come home to take care of people who are sick, and you go on from there. So of course the person on the other end will say yes, and they ask you questions. What type of patient? What is the diagnosis? How old are they, etc. And we go down a chain of questions. With CSSL, we would come to do a site assessment to get a better appreciation of the patients, their space, who they are, understand the ailment, see what limitations they may have physically, how the patient looks, their size, etc. And it's a host of things, right? And we make an assessment based on that. Also, by getting an appreciation of the person and their personality, we're able to match suitable caregivers for that person. We are not coming to cook. If we do, because we are lovely Caribbean people, that we will provide meals and we will make meals for persons, yes, we do. However, we are not cutting up chicken. We are not peeling and cleaning shrimp. We are not blending a bag of seasoning from Paramin. We are not cooking lunch every single day based on who the family member is living there, their dietary needs, and whatever they feel like eating that day, and then proceeds to invite persons to come for lunch. And the caregivers are preparing these meals. Meanwhile, when the caregiver is in the kitchen all this time, who is with the patient? If the patient should fall, if something should happen to the patient should be getting a stroke, we are busy preparing meals for the client, yes, for the patient as well. And on top of it, this particular client had the audacity to tell my caregivers, and I'm highly annoyed now, right, that, oh, don't forget to cook for the housekeeper because she's coming today. When we started, this said client had a cook and a housekeeper. Unknowing to us, and yes, I would say we dropped the ball, but unknowing to us, he had his own plans happening. We are not there, do not, and I want you all to watch this logo and watch it well. That if you all are planning to call us or engage our services, you are calling me or my coordinator at the office and speaking about a patient care strictly. We are not there for your personal needs. That is a no-no. You are not going to take advantage of my hard-working ladies. Our caregivers work damn hard. They are committed, they are dedicated. You are not going to take advantage of them. Because why? We are just caregivers. You think we just there just to what? Give out medication. We don't have any degree. We don't have a doctorate. So you belittle our ladies. That is disrespectful on many levels. And some of you watching this might say that I'm going overboard. But you know what? This is personal for me. Because I was brought up by two very strong parents. And they always taught me, Asha, you treat people fairly. Treat people how you want to be treated. Do not take advantage of people. Do not belittle people. And do not disrespect anyone. Even though they may put you in a position or they may say something to disrespect you, hold your head high and it's better you walk away. So clients who may be watching this, potential clients or anyone else looking at this, once you see this logo and you have intentions of calling us, ensure that we are taking care of your loved one. Understand the role that you're calling us, because when you call the doctor, you're not going to tell him, hey doc, could you go and put out the garbage for me? You're not going to ask him, oh, you could bake bread and had my caregivers baking turkey and ham and fruitcake for your household, for your family coming over, when your siblings come over or other relatives, you have my caregivers cooking meals. Are you mad? So I want it to be understood that this logo, I don't care about other agencies or anyone else, but even other caregivers that you are engaging them to care for your loved one. Let them do that. Do not disrespect us. We are the ones who take care of the patients. We are the ones who are on the line with the patients. We going down in the trenches with the patients. A lot of times we are the ones who are bringing them back because everybody else have given up on them. Do not disrespect my ladies. That is something I will not tolerate. I don't care how much money you want to pay me or intend to pay me or paying me, it is not worth it. Do not disrespect us. Because caregivers are the people who take care of your loved ones. We are the ones who are doing all the hard work, all the heavy lifting. We are the ones who damage our backs because some of you all do not want to get a hospital bed. And that is another thing too. When you have a bedbound patient, you are supposed to have a hospital bed. You do not go into any public or private hospital and see a queen size or king size bed. That's a whole other topic. But right now, please, families, I'm asking you all to please be respectful of those of us who are providing caregiving services to your loved one. It doesn't just stop at CSSL, but every other agency, every other senior home, every single caregiver out there who is coming into your home to care for your loved one, leaving their families and giving all that they have. Do not ill-treat us, do not disrespect us, and do not take us for granted or take advantage of us.